Okay, hey everyone. The cancer I chose to talk about is non-Hodgkin's lymphoma. Start off by saying that the difference between Hodgkin's and lymphoma are the presence of Reed-Sternberg cells that can be identified under a microscope. If you see these, you have Hodgkin's. If they are not present, then you have non-Hodgkin's lymphoma. The tissues involved in non-Hodgkin's, non-Hodgkin's lymphoma is a cancer that starts in the white blood cells called lymphocytes. Most common symptom of this is swollen lymph nodes. Lymphomas can start anywhere where lymph tissue is found. The major sites of lymph tissue are found in the lymph nodes, which can be all throughout the body, including inside the chest, abdomen, and pelvis. You can see it in the spleen. There's lymph tissue in bone marrow and in the thymus. And you can also have it in the adenoids and tonsils, and of course in your digestive tract. Since non-Hodgkin's lymphoma is kind of a really broad cancer, the classification can be said by the type of lymphocyte that it started in, how the lymphoma looks under a microscope, the chromosome features of the lymphoma cells, or the presence of certain proteins on the surface of the cancer cells. After this, it can be typed as indolent or aggressive, meaning indolent meaning that it's slow to start. It's going to progress slowly and then spread out slowly. Aggressive, it means it starts and then it just metastasizes everywhere fast. Some risk factors, there's actually a lot of risk factors for non-Hodgkin's lymphoma. It most often affects adults age 60 and older, but children can get it too. White men are at a high risk for developing it. If you've had a first-degree relative, such as parent, child, or sibling with it, it increases your risk. Some studies have shown that chemicals such as benzene and certain herbicides and insecticides can increase the risk. Some chemo drugs used to treat other cancers can then cause this type of cancer. Some studies have shown that certain drugs used to treat rheumatoid arthritis, such as methotrexate or the tumor necrosis factor inhibitors, can increase it. Radiation that you would use to treat your other cancer can then start causing this type of cancer. If you already have a weakened immune system, because you've had an organ transplant causing you to need those drugs that would inhibit you from rejecting your organ. If you've had HIV, you're at increased risk for this. And then certain autoimmune disease such as rheumatoid arthritis, lupus, and celiac disease can increase your risk. Again, weight plays into effect. So if you're overweight or obese, you have an increased risk. And what I found interesting is that if you've had breast implants, you are at risk for developing a certain type of lymphoma, which I found weird. The statistics is there's about 30 different kinds of non-Hodgkin's lymphoma that exist. It was estimated that 70,000 new cases of this type of cancer would be diagnosed in 2012. Recently, this disease counts for 4% of all cancers in the U.S. It is estimated that about 20,000 deaths, which about 12,000 are men and 8,000 are women, will die from this disease. Some treatment options you have are chemotherapy, which you can get orally or injecting. You can do radiation, which uses high-powered beams and protons to kill those cancer cells. You can do a bone marrow transplant. or it's also known as a stem cell transplant, which uses chemotherapy to basically kill off all your bone marrow so that you can start again. And then there are some biological therapy drugs that can help your body's immune system fight off this cancer. One of those is called Rituxan. It's a type of monoclonal antibody that attaches to B cells and makes them more visible to the immune system, which then your body decides, well, this is what I need to attack. You can do radioimmunotherapy drugs, which are just monoclonal antibodies that carry a radioactive isotype, which once you take it, those antibodies then find those cells, and that radiation then attacks it. How you're diagnosed with this disease, your doctor will likely ask you about personal and family medical history, and then there's several tests that he can use to decide whether or not you have non-Hodgkin's lymphoma. First of all, you're going to do the physical exam, so your doctor will check for swollen lymph nodes, including the ones on your neck, underarm, and groin, as well as searching for a swollen spleen or liver. There's blood and urine tests, imaging tests such as MRI, CT scans, and then, of course, there's lymph node and bone marrow biopsy. So with this, they'll place it under a microscope to see like what exactly is causing these. There's 4 stages of non-Hodgkin's lymphoma. Stage 1, it's limited to one lymph node region or a group of nearby nodes. Stage 2, it's in two of the lymph node regions, or the cancer has invaded one organ and the nearby lymph nodes, but the cancer is still limited to the body, either above or below the diaphragm. Stage 3 is when the cancer moves to lymph nodes both above and below the diaphragm. Stage 4 is the most advanced stage of non-Hodgkin's lymphoma. Cancer cells are in several portions of one or more organs and tissues. Stage 4 may affect also other parts of the body, such as liver, lungs, or bones. Prognosis of NHL can be good, but again, it depends on the type of lymphoma and the extent of the metastasis that happened and response to therapy. So your healthcare provider will have to discuss that prognosis based on those symptoms. But statistically speaking, the overall 5-year survival rate for people with non-Hodgkin's lymphoma is 71%, while the overall 10-year survival rate is 60%. So those are good odds, I believe. Some other interesting information is a non-Hodgkin's lymphoma can arise in any lymph node in the body, whereas Hodgkin's lymphoma begins in the upper body, such as the neck, chest, or armpits, and then will spread. And then what also I found interesting was that your doctor can use the letters A and B to indicate whether or not you're experiencing symptoms of non-Hodgkin's lymphoma, which A means that you don't have any significant symptoms of the result of the cancer, and that B indicates that you have significant signs and symptoms such as persistent fever, unintended weight loss, or severe night sweats. Thank you.